Before you panic after receiving seemingly alarming news during labor and birth, which kind of derails your entire birth plan, listen to this video first. I have an important message for you mamas, and that is there is a big difference between actual complications and normal variations of labor and birth. So if you want to learn more about what these normal variations are and how to distinguish them apart from actual complications, then keep watching. Hi everyone, my name is Renata De Castro. I am an Ayurvedic practitioner, birth and postpartum doula. I am passionate about helping women to holistically heal, to optimize their pelvic health, as well as to prepare for empowering labor and birth experiences and beyond. So today we are hopping into a very important topic I feel like every woman should be knowledgeable in, especially if she's about to give birth. And that is understanding the difference between actual complications during labor and birth and normal variations. To begin, let's talk about a normal physiological birth. That is giving birth without medical interventions. You are allowing your body to do what it was made to do by giving it the right support. You are supporting the natural process, the natural unfolding of labor and birth. Things like helping oxytocin to flow freely and allow your body to progress on its own time. However, in today's medicalized, heavily medicalized birth culture, many things like normal variations in labor and birth are lumped into what are considered to be complications. So therefore, normal variations of labor and birth are actually being pathologized. And this leads to unnecessary interventions, disrupting the entire physiological process of labor and birth. It's important to note that if you are giving birth within the system with an OB, it's important to know that most OBs have never witnessed a normal physiological birth before. And that is because they are trained to intervene when things go wrong. So they are looking at your labor and birth experience through the lens of fear and alertness and just on the lookout for something to go wrong or something to veer off course that was not necessarily in their textbook. And so that is a different tangent that I can go on and on about another day. But OBs are trained in a certain way and they are going to approach labor and birth that way. And it's not to honor a normal physiological birth. They are not knowledgeable on how to support a normal physiological birth because in the system, birth is heavily controlled. Things need to be managed, and they are doing this because they've got to watch their back in case a malpractice lawsuit is launched against them. So they are going to do everything in their power to show that they are controlling and being proactive in your labor and birth experience in order to avoid complications. But ironically, it is their unnecessary interventions and over control and managing of the labor and birth process that actually causes the complications. So this is just something you need to be aware of when giving birth in the system. And learning how to navigate the system is very important if this is the route that you are choosing. There's no point in fighting the system, it's about navigating it. So let's go ahead and talk about some normal variations that all too often get lumped into what we consider complications. So normal variations, such as giving birth to a breech baby, is lumped in under complications, and that is an automatic C-section in the medicalized birth community. However, it is possible to give birth to a breech baby if you are with the right care providers. And again, going back to their training, a lot of care providers are just not trained in supporting women to give birth to breech babies, or they're not, and they just lack the knowledge of a normal physiological birth. So this is considered a normal variation. A posterior baby. So this is not considered to be the most optimal position for the baby to be in, but if they are in occiput posterior position, it is still possible to have a healthy baby. It just means that labor might take a little bit longer. A long labor. Before we even dive into that, well, how long should labor be? See, this is a normal variation that the medicalized birth community cannot accept, and they oftentimes put a set timer on labor in birth once you're admitted. And this is done for various reasons. It could be how many people they have on staff. This could be just due to the doctor's personal schedule. It could be for so many reasons that are just not necessarily women-centered. It's not centered around the birthing mother's needs at all. And so putting a timer on labor and birth is not necessary. It's about patience. It's about waiting it out and supporting the normal physiological process. But what happens is that if labor takes too long, or if there's a pause during labor and birth, women are often met with medical interventions such as Pitocin to help increase contractions to speed up the process. And this carries very heavy risks for mothers, as this can contribute to uterine rupture. So there are many things to consider when accepting medical interventions, and it's about knowing what risks they carry, because they all carry very heavy risks that every mother should be knowledgeable about. Another normal variation is finding meconium in the amniotic fluid. And so this is just a normal occurrence as babies' digestive tracts do mature over time, and especially closer to their estimated due date and when they go beyond their estimated due date. It has been shown in past studies that babies are actually born with some meconium fluid within their bodies, and that's why it's important to support the normal physiological birth process in order for their bodies to be squeezed by the birth canal, helping them to expel extra fluids from their lungs and their nasal passages. So there is a very good reason why a normal physiological birth needs to occur without medical interventions. Your body has it all figured out. So these are just a few examples of normal variations and in which babies can be born perfectly healthy and be born via a normal physiological birth process. And it's important for your birth team to be very knowledgeable in the normal physiological birth process. Now let's discuss true complications. In most cases, this is where the natural process of a normal physiological birth process is being interrupted. So complications can arise due to medical intervention that was introduced way too soon in the labor and birth process. So that could be being induced with Cervidil or Pitocin, which carry very strong side effects like uterine rupture, and therefore a necessary C-section will be scheduled. Or complications can occur for very natural reasons, and that could be placental abruption. And that's when the placenta detaches from the uterine wall prematurely. So There are so many reasons why complications would occur. And so just to give you an idea what is actually considered a complication, it would be a risk of uterine rupture. Uterine rupture is one complication. And it's a very, very, very rare that this would happen under a normal physiological birth process. It is actually very likely to occur when pharmaceuticals are introduced into the labor and birth process, such as giving the mother Cervidil or Pitocin to increase contractions. And when women are induced in labor and birth, they experience very abnormal contractions that are very strong and beyond what is normal and natural. Because the uterus is contracting at such an abnormal rate and strength, it actually can cause fetal distress. And this is why a lot of women end up with emergency C-sections, because their fetus is in distress due to the intervention that was given. Some people would consider shoulder dystocia to be a complication, and some would consider it to be a normal variation. And that is just when the baby's shoulder suddenly gets stuck in the birth canal, but it can be supported. There's so much evidence out there that shoulder dystocia can actually be supported by knowledgeable practitioners, and medical intervention is usually not needed at all for something like this. It might take a little bit longer for a mom to get baby back into the best position to be birthed. But this is often lumped into complications, so there is a little bit of debate over that. Preeclampsia is another complication where the mother has high blood pressure. Severe postpartum hemorrhage is another complication that will need medical attention. However, it has been shown that when birth is heavily managed in the third stage, so that is when you birth the placenta, if it's being ripped out of your body and if you are not birthing your placenta naturally, you are more at risk for a postpartum hemorrhage, especially if you are given Pitocin after to help your uterus contract in order to close up that gaping hole of where your placenta used to be. It carries that risk of uterine rupture, so it can actually do the opposite, where your uterus is way too overstimulated due to this management of the third stage of labor and birth. By understanding what is a normal variation of birth versus what is actually a complication can really help you to make those informed choices during labor and birth. And therefore, this sets you up for a more empowered experience, especially if it's a normal physiological birth that you are aiming for. So here are a few tips to just help you feel more empowered and informed during your birth experience. Number one, educate yourself. Educate yourself on complications and what normal variations are. Number two, build a supportive birth team. Know your care providers. What are they able to support? Can they respect the normal physiological birth process? And do they understand your preferences? Number three, have a birth plan. Outline your expectations for your normal physiological birth. And if interventions are being recommended during your labor and birth, number four is ask questions. Is this medically necessary? What are the risks and benefits? Are there any alternatives? What happens if I wait and do nothing? Now, you may not get all of the information on the spot, and that is why preparing for labor and birth beforehand with a doula to help you navigate these situations and to be more informed of what you might be offered in the hospital is very key. Knowledge is power, and being informed during labor and birth will set you up to have that empowering birth experience no matter how it unfolds. So remember, birth is a natural process. Your body knows what to do. By understanding the difference between normal variations and complications, you can approach birth with more confidence and trust in your instincts. If you found this video helpful, give me a thumbs up, like, and subscribe. Share this video with mamas who need to hear this message. Until next time, trust your baby, trust your body, and trust the process.